All right, welcome back. We've got the docs here at Ignite Chiropractic, and the condition of the month is low back pain, bread and butter. I don't even like saying that because that's gluten and dairy. I don't do gluten and dairy, but that's like chiropractor's thing, right? So we take care of low back pain. Number one complaint, number one reason why people get put on opioids and pharmaceuticals and left and right. Number one misunderstood condition that probably over 85% of people are going to have some severe type of low back pain at some point in time in their lives, let alone the variations that go from there. So let's just get right into it. How do we want to kick this off, Dr. Lee?
So best is probably to start with what are the different causes of low back pain, because not all back pains are created equal. You got some people that are coming in and they say, oh yeah, my back pain, I did this stretch and all of a sudden it went away, and then another person tries that same stretch and it gets far worse, and sometimes it's exacerbated. One person does this thing and then they try that, and it's just all over the board. So what worked for one person may not work for you or for anybody else for that matter. So it's a difference in understanding the different triggers of low back and what that actually looks like. So I'll go ahead and kick it off and talk about the disc, because the disc is something that is a cushion between the bones in your spine. And if the bones in your spine aren't moving the way that they're supposed to, they're moving too much. The cushion in between that is kind of propping and distancing the bones, it's like a big jelly donut. What happens is it has way too much motion on this structure. And what that'll do is that'll start to cause wear and tear, and it'll actually start to break it down. Now, what's cool is the body is always regenerating. And this is something that everybody forgets about, because even the disc is regenerating. So you have excess wear and tear. Well, you might have had excess wear and tear 5 years ago, but that doesn't mean that you're going to be all screwed up for the rest of your life, because it can regenerate and repair itself. The problem only comes when you have damage and you've had these abnormal stresses so frequently and so often that it exceeds your body's ability to heal itself. Or the speed at which the body heals itself. So you're breaking yourself down faster than the body is building itself up. And then what that does is that sets up for problems with your disc. So people have heard of disc bulges. I have a bulging disc. I have a protruding disc. I have a disc herniation. Those are all variations of the same thing, where that disc and that cushion gets damaged and inflamed. And what it does is it can start to, one, cause muscle pain, and back, just general back pain, but it also can start to cause nerve involvement. And that nerve involvement, where most people know, is that's where you get the pinched nerve that starts going down and causing sciatica, going all the way down into your leg. So can you talk about sciatica, Dr. Chris, and explain a little bit more about what the symptoms of sciatica are, and what people can be presenting with if they start feeling this, and showing how it stems from the back.
So feeding off of the nerves that come out of the low back that actually form the sciatic nerve, or where those nerves can be bulged, those discs can bulge onto those nerve roots that make up that sciatic nerve. That sciatic nerve goes from those nerve roots, travels down into the buttock, splits down here at the knee, goes into the front of the shin and into the back of the calf, goes down in the top of the foot and the bottom of the foot. That travels all the way down, causing that numbness, tingling, burning, fatigue, muscle weakness, all of those type of symptoms, but most of the time it's that sharp shooting pain that hits them in the butt, lightning all the way down the leg.
Mm-hmm. And sometimes it's not all the way down the leg.
Yeah.
No. Nope.
And sometimes it can be isolated. Sometimes it's just in the buttock region. And just right here, they're like, oh, and a lot of times the physical therapists want to call it piriformis syndrome, right? Oh, it's piriformis syndrome. Oh, I just need to sit on the tennis ball and roll it, or let me foam roll it out. And I'm kind of making fun of that right there, because, okay, why did the piriformis get tight to begin with?
Exactly. So is it the nerve being compressed on? Is it, well, we're going to talk about this in a second. Is it the facet joint putting pressure on the nerve as well? Is it a malmotion bone? Is it a pelvic misalignment that's putting pressure on that sciatic nerve as well? There's a lot of different variations. And the piriformis muscle, we know that it can be on top of the sciatic nerve. The nerve can go through the muscle. There's so many different variations of what could be going on there. So it's not just a one size fits all.
And there's actually new research that just came out that's actually showing that piriformis syndrome may not even ever have existed as a cause for sciatica ever. Yet that's something that's commonly discussed. So it may be a contributing. It makes sense on why it can be a contributing factor, but it may not even at all if the research that's come out is accurate about that. Yeah. So that's that sciatic nerve. And then how about muscle spasms?
Yeah, I mean, you can, bend or twist or do something where just a muscle will lock up, and then that's just going to irritate and put more compression into that low back, which can then cause more compression on the nerves that are going on in that muscle, and you can kind of get into this vicious cycle where it just creates more and more pain as you go on.
Exactly. Well, and then build on that even further, because why? And then it's like, why are the muscles locking up to begin with, right? I always go back to that. Like, why are your muscles locking up? Because we get a lot of people in the office, they're like, oh, I just haven't been keeping up with my massage, or I haven't been doing the proper exercises, I haven't been doing my foam rolling, or whatever it is. And it's like, sure, go get the massage because it feels good, because it relaxes you to get that lymphatic flow. But if they keep working out those trigger points of those knots and those kinks, and like those knots and kinks, what happens? They keep coming back. So why do they keep coming back? And if we're going to focus into the low back specifically, it's because your body's trying to stabilize you, it's trying to support you, because the body knows that something is not moving the way it's supposed to, and so it's trying to protect you. So when you're going and getting those knots and those kinks worked out, or massaging and working it really hard, you're actually removing the stabilizing or the apparatus of your body naturally trying to support you and help you.
It's like if you've ever had your calf go into spasm and start cramping on you, you can, like the minute it kind of goes away and it subsides, you can feel your calf and it's like a rock. There's knots all through it, and it's because that muscle belly became fatigued, and that may have been not enough nutrition, that may have been dehydration. There's multiple causes on what can cause a muscle to go into spasm. But if a muscle has been used too much, too often for what it's designed for, then what happens is it will start to go into tetany. It'll start to go into spasm, and it literally locks down, and that's what starts to happen. So if you start feeling those cramps that are coming back, and those muscle spasms that are there, and those knots that keep developing, it's because those muscles are being used way more than they're supposed to. Because the big muscles that you can actually feel in your back are not the ones that are actually even stabilizing the spine. They're actually there. They're supposed to be, when you do you put electrodes on the spine or along the spine of where the muscles are on the back, you can actually read how much muscle activity is there. And when you do that, when a person is standing up, you would expect it to have to be like all lit up. That your low back is going to be really, really locked down and tight because you're standing up against gravity. In fact, that's an abnormal scan. That is an abnormal pattern. They should actually be what we call quiescent. It should be very inactive, because the primary stability is much deeper than the surface level muscles. But when there is a problem, those muscles around the spine, the deep stabilizing muscles, they are no longer functioning appropriately. They shut down, so the body has to use the backup system. And that backup system is the muscles now that you're feeling that are cramping, that are going into spasm, that when you go to the massage therapist, which is why you and I, we've seen this a ton, is that people will be like, I went to the massage therapist and like they did something and I'm way worse now. And the massage therapist did the right thing. They worked out all the kinks out of the muscle. They got that spasm to loosen up and to release. However, why was the spasm there in the first place, which is what you were getting at.
Exactly.
And so now they just removed the compensation mechanism that the body said, like, hey, we don't have deep stabilizing, so we're going to use these big ones. It's going to suck and it's going to hurt, and you're not going to be happy about it, but we have to protect the spine somehow. And all of a sudden you just go and be like, we worked that out, we stripped it away, or did some like heavy trigger point therapy,
like Graston and like tool work and everything,
or Rolfed it out or something like that, and all of a sudden the person is like, everything collapses and like the nerve gets crazy. You have something to add?
I was going to say that's a big reason too why you start losing different motions, because those big muscles are the ones that are supposed to help you bend side to side and move around. And when those deep stabilizers aren't working, you have to go to that backup system to stabilize. The brain will do whatever it has to do to create stability. And so it locks down those muscles, and then now all of a sudden you can't bend over to tie your shoes anymore because of that. And that's a big part of it.
Exactly, yeah. So just to give like a little example, I always give people the analogy. It's like you going to work and doing a 4-person job, and suddenly now those deep multifidi or those deep stabilizing muscles that are really tiny little muscles all around your spine giving feedback, it's like they have shut off. So now you're doing a 4-person job and there's only one person doing it. And so now that's not energy efficient either. So it's very wearing, it's very tearing, let alone the breakdown and the pain that it's causing even more of an energy breakdown. So it's not an efficient way, but just like Dr. Sean had said, is the body's going to do whatever it needs to do to support and stabilize the body for protection. So it's actually doing a good thing to help you. So don't feel like your body is failing you. It's not. But you just got to get to the main means of what's causing that to begin with, and don't just take a pill to try to shut it up. Because what often when you go to the medical doctor, they're going to be like, "Well, take a muscle relaxer." Sure, let's relax the muscle that's trying to stabilize you, and then what, right? And so
Same
now
thing happens. Like it's only going to get worse down the road.
and you start moving in ways that are going to create further damage because you have this artificial idea that you're better because you feel better. And I'm putting air quotes around it because and the muscle, maybe it relaxes the muscle, but then again, there's still the damage that caused the muscle to become a spasm to begin with. So still, it's not helping anything. It actually could cause further damage because of that false sense of confidence.
Yeah. And like you're saying, it breaks down faster. So you have one worker doing all the work, and then everything else is on vacation, but he's going to start breaking down faster and faster and faster and faster. So your body starts building up bone, you start building up arthritis, you start making those perfect compensations, but they're not optimal in the long run because now bones start to fuse, bones are starting to try to stabilize everything on those destabilized areas. So we got to get all the workers back to making sure everything's working again. Start asking the whys a lot more than just letting it, take the pill, I did the stretch, it didn't work, do all these things that the medical doctors want us to do and nothing's working.
Exactly.
So,
ask the why.
And all of these they point back to destabilization of the spine being the first thing that starts to happen. So destabilization of the spine, loss of the integrity of how the joints are being controlled is going to lead to disc damage. It's going to lead to muscle spasms. It's going to lead to facet syndromes, which are other small joints that start to cause pain syndromes that start firing off and getting very angry and sending referral patterns in different directions. It'll be the cause of sciatica. And then when you start to destabilize that area, it starts to send pain or extra compensation up the spine. So if we're talking about low back, now you have mid back, upper back, neck tension, because this is the foundation point of everything else. And then that's going to lead to degeneration or arthritis in the spine. People say, well, is arthritis just an old age thing? And it's not an old age thing. It is an instability thing for years. You're unstable for years. Guess what? Your spine is going to look thrashed, and that's arthritis that's starting to show up. So if you have arthritis, that means your spine has been thrashed for years, and it's even more important now that you get this corrected or at least maintained to some degree, because sometimes you can't fully undo it depending on how much damage is in there. But you can stop the rest of it from following in the same fate, or at least slow it down dramatically depending on the situation. So it's really important that you look first to the spine. Now there's some other things that we didn't discuss here that can also be triggering back pain, and those can be visceral issues, meaning organ-based.
Issues.
Yep.
Like someone who's really constipated and their digestion's not working well, they can have low back pain. Yeah, kidneys, you said, like that can refer pain. person with other types of issues in the stomach, they can give mid back pain. But those are kind of the other variables that need to be checked for and screened for, which is what we do in our process here as well, to make sure that, hey, if we're taking you on in our office, one, we're going to take motion study x-rays to see what is the integrity of your spine, not just when we look at it, but what does it look like when we're moving, when you're actually moving.
And in extreme movements at that.
Yep. And we'll be able to see not just what you look like you're doing compensation-wise, but how the spine itself is moving, which it tells so much information. But then we'll also be able to determine if this is likely coming from something that's maybe visceral related that we can't help you with. But our goal is to find the people that we can work with, and then send the other people into that we can't help to the right place, so that no matter where you're coming from, you're going to be able to be served and be taken care of in our office.
And to be a referral and a liaison too, because really two things can be going on at the same time, because even when you do have visceral issues, there's inflammation, irritation that happens within the body that will also affect the nerves within your spine and can alter the way you're moving. and then create wear and tear and damage. So it's really a good idea to look at it at the same time. Of course, take care of the most severe, but then also making sure you're paying attention that you're moving your body, because that's how your body creates nourishment. Moving properly is what creates the charge for your body to begin with.
Yeah.
So that just goes into a whole nother thing. Posturing isn't just about how good you look the way you're posturing. The posturing gives us a lot of information about the integrity of your nervous system and how well that's working and how well that's communicating with your spine to keep the proper alignment, the proper balance, the proper posture.
Crucial.
Yeah.
All crucial. So that about wraps up what we wanted to share right now, kind of like on a brief overview of low back pain, what you need to know. So if you have any friends or family members who are dealing with this, send them this video, because a lot of people don't know what's going on and what their problems are attributed to or could be attributed to. So oftentimes more information arms someone to make better decisions. And so that's what we want you to be able to provide, either if this is a loved one that you care about, or a friend or a colleague.
And pregnant patients as well. I have to say this before we close this up. Being a woman here in this mainly dominant masculine area here, and women, like, number one complaint why they come in to see, like, while they're pregnant, is number one complaint of low back pain. Okay, so let's make sure you mamas in there. Is it safe to get adjusted? Yes, it's recommended to get adjusted. I could not imagine going through pregnancy without getting adjusted for various reasons of everything we've already talked about. Like, imagine your body prior to the baby growing inside of you, and then adding the extra pressure of a growing baby inside of you because of the misalignments in the pelvis, because of what's happening in the low back, because of all the things that, like I said, that are already happening prior to that. Come in, get adjusted, you can get corrected, and it's going to help the baby in the process too, and it can possibly help with the baby's positioning and comfort at the same time. So definitely think about that if you have any pregnant ones, or you yourself watching this are pregnant as well.